the biomechanical dysfunction and its impact on injuries. Hi, my name is Gary Kaufman. I'm certified neuromuscular therapist, specialized with strain counter strain technique. This video is for the people who like to work out, run, dance, etc. They eat well, they have good diet, they think they have good lifestyle. They still complain about pain, especially when they are active. The main cause is because the biomechanical dysfunctions of the body. And let me explain exactly what it means. The body has to abide to laws of physics. Number one, gravity. Gravity is about 3.5 pounds per square inch, which is equivalent to 10 phone books on our head. It's a lot of weight, and the muscles have to deal with this force. Secondary, for every action, there is an equal and opposite reaction, and it will show up with the muscle system. The gravity center is between the hips, between L5 to S1. Most people don't have level hips. They should, but they don't. They don't because most of us are right-handed. We tend to favor right side. So we tend to use the hip flexors much more on the right side than the left. Also, we tend to drive automatic cars. So we use more the right hip flexors, especially the psoas on the right side than the left. Eventually, this muscle will get tired. It will get tired, it will get in spasm. Once this muscle is in a spasm, it will change the position of your right hip and rotate it forward anteriorly between 1/8 of an inch to an inch. As soon as this hip rotates forward, it will push your leg down to make it longer. Once this hip rotates forward, it will push your right leg down. While you're on your back, it will be the longer leg. Most of the time, I do not find any anatomical discrepancy between the legs. The difference is because the right hip rotation will push your right leg down, and it will make it longer. Once you stand up, naturally, you will shift the weight to the shorter leg, the left leg. As soon as you do that, your hips and spine will shift to the left. All this information will be sent to your autonomic nervous system, which is responsible to keep the eyes level. It's a reflex. It's called writing reflex. It has to keep your eyes level. If they are not level, you get dizzy. So if you shift into the left, immediately the nervous system would ask the muscle on the right side of the body and the hip to shift to the right. Once you shift to the right, the nervous system says again, hey, you are too much to the right. And I need you to lift your left shoulder to level your eyes. All this compensation mechanism, it's just the attempt of your nervous system to keep your eyes level. But because your foundation is twisted, is off, it will affect the whole muscular system. So more and more muscle will be asked to compensate. They would get tired. Eventually, they would get in spasm. You would get in spasm. You will start to feel the pain because the lack of oxygen into the muscle. When the hips are not level, it's like driving a car with a flat tire. The car will swerve to the left, you pull to the center. This is what the nervous system does every second to keep the eyes level. If they are not level, we cannot function. We get dizzy. Unfortunately, most people don't understand the biomechanics, and they think if they try harder Run faster, the pain will be gone. Well, they make it worse. They exacerbate the dysfunction, because if you have a flat tire, you are going to slow down, not to go faster. Well, the faster, the harder you use the body with this biomechanic dysfunction, you are more accessible to injury. And because your gravity center is off, it could affect your knees, your ankle, hips, back, neck, or shoulder. Because there's constant relationship because your foundation, the gravity center, and your eyes.